CNA Online Test. Welcome to the quiz. A resident asks a CNA why a medication is being given. What is the best response? Care Scenario 18. Is it A, explain the medication purpose in detail? Or B, tell the resident to ask the nurse? C, guess based on past experience? Or D, ignore the question? The answer is B. CNAs are not permitted to explain medications. Directing the resident to the nurse ensures accurate information and stays within the CNA scope of practice. Guessing or ignoring questions can lead to misinformation and loss of trust. Next question. During a bed bath, a CNA notices the resident is shivering. What should the CNA do? Care Scenario 19. Is it A, finish quickly and leave? Or B, continue bathing without change? C, cover the resident and adjust room temperature? Or D, document it later? The answer is C. Shivering indicates the resident is cold and uncomfortable. Covering exposed areas and adjusting the room temperature helps maintain comfort and dignity. Comfort is an essential part of quality CNA care. Next question. Why is it important for a CNA to measure intake and output accurately? Care Scenario 20. Is it A, it helps with billing? Or B, it shows how much the resident eats? C, it helps detect dehydration or fluid overload? Or D, it replaces vital signs? The answer is C. Accurate intake and output tracking helps the healthcare team identify fluid imbalances early. Dehydration or fluid overload can lead to serious health issues, especially in older adults. Next question. A CNA is caring for a resident with dementia who becomes agitated during evening care. What is the most appropriate action? Care Scenario 21. Is it A, correct the resident firmly to stop the behavior? Or B, speak calmly and redirect the resident to a familiar activity? C, leave the room until the resident calms down? Or D, restrain the resident to prevent agitation? The answer is B. Residents with dementia may become agitated due to confusion, fear, or overstimulation, especially in the evening. Speaking calmly and redirecting the resident helps reduce anxiety and maintains dignity. Firm correction or restraint can increase agitation, and leaving the resident alone may worsen confusion or risk injury. Next question. A CNA notices redness on a resident's heels during care. Why is this finding important to report? Care Scenario 22. Is it A, it indicates poor hygiene? Or B, it may be an early sign of a pressure injury? C, it shows normal aging? Or D, it means the resident needs new shoes? The answer is B. Redness over bony areas like the heels can be an early warning sign of pressure injury. Reporting this allows early intervention, such as repositioning or protective devices, which can prevent skin breakdown and serious complications. Next question. A resident asks a CNA why a medication is being given. What is the best response? Care Scenario 23. Is it A, explain the medication purpose in detail? Or B, tell the resident to ask the nurse? C, guess based on past experience? Or D, ignore the question? The answer is B. CNAs are not permitted to explain medications. Directing the resident to the nurse ensures accurate information and stays within the CNA scope of practice. Guessing or ignoring questions can lead to misinformation and loss of trust. That's it for today. Don't forget to like and subscribe. Tell us how many you scored out of 6 in the comments, and let me know what topic I should post next. Bye!